Did you know that accurate blood pressure measurements are crucial for the diagnosis and management of hypertension? Let's dive into the recommendations for blood pressure measurements in the office and at home. To ensure accurate blood pressure measurements, you need a validated automated electronic upper arm device with an appropriate cuff size. Check www.stridebp.org to see if your device is validated. At the first visit, measure the blood pressure of your patient in both arms. An inter-arm, systolic blood pressure difference of over 10 millimeters of mercury must be confirmed with repeated measurements. If confirmed, the arm with the higher BP should be used for all subsequent measurements because its values more accurately reflect the BP level in the major arteries. Using BP taken on the arm with the higher reading seems to improve the outcome prediction. A consistent inter-arm systolic blood pressure difference greater than 15 to 20 millimeters of mercury may be due to atherosclerosis and restriction of large intrathoracic or upper arm arteries, requiring investigation for arterial disease. To measure blood pressure correctly, make sure your patient is sitting in a quiet room with a comfortable temperature. Your patient should remain seated and relaxed for 3 to 5 minutes and should not talk during or between measurements, with their back supported by the chair. Legs should be uncrossed, with feet flat on the floor. Arms should be bare, resting on the table, with mid-arm at heart level. Smoking, caffeine, food, drug intake, or exercise should be avoided 30 minutes before measurement. At your practice or pharmacy, you should take 3 readings with 1-minute interval between the readings. Use the average of the last 2 readings. For home blood pressure measurements, it is important that your patient measures the blood pressure in the morning and in the evening for 3 to 7 days before each office visit. For each time, the patient should take 2 readings with 1-minute interval. Use the average of the 2 readings. If the patient has done all readings of all days, use the average of all readings excluding the first day. Home blood pressure monitoring is recommended by the European Society of Hypertension, in addition to office blood pressure monitoring, to improve cardiovascular risk prediction and for long-term follow-up of treated hypertension.